Hi, I'm Dr. Michelle Lee, a board-certified ophthalmologist. There are so many machines and tools we use in the eye clinic, and today I wanted to show you some of my favorite eye exam tools that we use in our eye clinic and how they help us examine your eyes. One of the most important measurements we can take in the eye clinic is the eye pressure. A normal eye pressure forms and supports the eye. A high eye pressure means that the drainage system inside the eye is not working properly, either from an eye condition called glaucoma or as a side effect of medications or surgery. A low eye pressure means that the eye is not able to support itself, or there is a fluid leak somewhere in the eye that needs to be immediately addressed. So eye pressure is important, and there are so many ways to check eye pressure. My favorite way is using this handheld device called the Eye Care, a device that uses the principle of rebound tonometry. A small and thin probe hits the eye over a fraction of a second so the eye cannot feel anything, even without numbing drop. I love this device because it is so sneaky that we can even measure eye pressure in children and adults with dementia. Sometimes I don't like numbing drops in the eye because I like to use my next favorite tool, which is dental floss. As a cornea specialist, I see a lot of patients with very unhealthy corneas, and one of the main reasons for an unhealthy cornea is lack of corneal nerves. Without good corneal sensation, you lose your tearing reflex, your blink reflex, and your ability to make growth factors to help with corneal healing. So for a lot of the unhealthy corneas I see in clinic, I like to check corneal sensation, since the absence of normal sensation will change how I manage the eye condition. A common way to check sensation is to use a cotton swab, but this is very inconsistent. So I like taking a clean piece of dental floss and gently touch the cornea at various locations to see how the patient reacts and if they feel pain. My next favorite tool in the eye clinic is a wide field retinal imaging device. I absolutely love this device because it gives me a snapshot of over 80% of the retina without dilating drops. We can use this to screen for retinal pathology like macular degeneration, retinal tears and detachments, and tumors, as well as take photos of the optic nerve to screen and monitor for glaucoma. And the best part is that patients really appreciate that they don't need to be dilated every year for their eye exam. Another favorite tool I use in the eye clinic may surprise you, but it's earrings. When we examine parts of the eye, it is so helpful to have patients focus on my earring. So it functions as a fixation device. I'm really not much of a jewelry person, but I always make sure I have a nice pair of earrings that my patients can look at. My favorite imaging device is called the Pentacam, which is a device that can completely image the entire front of the eye. This machine has rotating cameras that take pictures of the front and the back of the cornea. I use this mostly as a cornea tomographer and topographer for patients with almost every type of corneal pathology. We can get a map of the cornea that can show us pretty much every irregularity, and this is great for screening for keratoconus, a cornea disease that affects the structure of the cornea, and to see if someone is a candidate for LASIK or PRK surgery, since there are so many different parameters that the Pentacam can measure that we can use for screening purposes. Let me know if you have a favorite or least favorite tool in the eye clinic. Please like and subscribe to my channel, and I'll see you in my next video.